Commons, resuming the adjourned debate on Bill C-14, an act to amend the criminal code and to make related amendments to other acts.
Resuming debate, the Honourable Parliamentary Secretary to the Minister of Natural Resources.
Thank you, Mr. Speaker. I'm here today to talk about an issue that touches the lives of every Canadian, how we die. It is not an issue that we usually like to discuss, but with the Supreme Court's decision in the Carter case, it is now at the forefront of our government's political and health agenda. Our February 6, 2015 Supreme Court of Canada unanimously declared that the criminal court prohibitions on physician-assisted dying were constitutionally invalid. These changes will come into effect on June 6th of this year. All governments are preparing to respond. Consultations with the public have made it clear that there is extensive support for the provision of medical assistance in dying. An Angus Reid research poll that was published earlier this month found that 90% of Canadians surveyed think that some form of assisted dying should be allowed. The government takes the Supreme Court of Canada decision seriously. It is a deeply felt and sensitive issue for all Canadians, and we understand that it is essential that implementation of this new legislation be undertaken with careful consideration. That is why the government has developed a framework based on empathy, appropriate protections for vulnerable Canadians, and the need for choice. Careful consideration has been given to the eligibility criteria, substantive and procedural safeguards, as well as recommendations for monitoring and reporting. I also want to make it clear, however, that medical assistance in dying is not to be the only choice for a peaceful, dignified death. No matter where people stand on the issues surrounding medical assistance in dying, they all agree that we must improve palliative care. Palliative care is a multidisciplinary approach to health care for individuals and families who are living with a life-threatening disease as well as other conditions. It focuses on improving quality of life through the prevention and relief of physical and psychological suffering, with treatment plans tailored to the needs of the patient and the family. Reports about the status of palliative care in Canada suggest that delivery of and access to palliative care and hospice care varies greatly across Canada. This is due to differences in regional demographics, societal needs, organization of healthcare services, and levels of funding. When asked, most Canadians indicate that they would prefer to die at home in the presence of loved ones. There is clearly a need to bridge this disconnect and for all levels of government to support the needs and desires of Canadians at the end of their lives to receive the most appropriate, timely and compassionate care. The gaps in palliative care have been raised repeatedly over the years by a number of organizations. It is very clear that Canadians are looking to their governments for leadership to close these gaps. In the past, palliative care in Canada has been delivered primarily in hospitals by specialists and largely to cancer patients in the last stages of their illness. While many people still associate palliative care with hospitals and cancer patients exclusively, it can be delivered to a variety of patients and in different settings, including long-term care facility or even one's own home. It is estimated that the health system is currently unable to provide palliative care to 70% of those who could benefit from it. This is why our government is taking immediate steps to address this gap and work with the provinces and territories so that more Canadians have access to the care options that are right for them when they need them. The government is currently funding the Pallium Foundation of Canada to support training in palliative care to frontline healthcare workers, and this initiative is complementing a previous initiative called The Way Forward. This is aimed at integrating a palliative care approach throughout the healthcare system and across a range of providers and settings. The federal government has also supported a number of initiatives to improve public awareness, healthcare professional education and training, national best practices, and standards and research. Federal investments in research also expand the depth and breadth of understanding of end-of-life care issues and how best to address them. Recently, the federal government has funded $14 million over 2 years to the Canadian Foundation for Healthcare Improvement to support applied health services research, as well as the Foundation's work to identify savings and efficiencies in the healthcare system, including in palliative care component. In Budget 2016, the government also committed to making compassionate care benefits easier to access, more flexible and more inclusive for those who provide care for seriously ill family members, and providing more flexibility in parental leave benefits to better accommodate unique family and work situations. Like other healthcare services, delivery of palliative care is mainly the responsibility of the provinces and territories. While each province and territory has some level of palliative care services, with some moving ahead with frameworks or strategies, there are wide variances both within and between jurisdictions. Many are focusing on integrating palliative care with other types of care across settings and services. However, Canadians' ability to access palliative care remains mixed, depending on where you live. The Government of Canada has committed to develop non-legislative measures that would support the improvement and a full range of options on end-of-life care. In the discussions with provincial and territorial governments toward developing a new health accord, our government has committed to providing $3 billion over the next 4 years to improve home care, including palliative care. Mr. Speaker, I firmly believe my own experiences with end-of-life care is not unique from thousands upon thousands of Canadians. Losing my grandfather John, my mother Gay, and my Aunt Babs is something that has never left me. These people were titans in my life. My mom and Aunt Babs taught me everything I know about being passionate, being determined, about giving of yourself to others, what it means to be a woman. They have both had such a profound effect on every day of my life. I'm here totally because of their legacy of excellence. Both of these women, who were so strong, so committed to family and community, who were both so harmed as human beings by diseases that ravaged them. I learned what it meant to sleep on the floor day after day because they were afraid to be alone. I learned how to administer morphine and Ativan, and that if they even whimpered, I was to give more, as that meant they were still being torn apart inside. I learned how to raise or lower a home hospital bed. I learned how important palliative care is, to have access to it. But these things are things I wish I'd never had to learn. From all of them, I learned in those last days, there was no peace. There was only pain. There was not dignity, only terrible uncertainty. There was not nobility in their suffering. I learned pity. Mr. Speaker, I'm proud to stand in the House today and express my support for this critical piece of legislation. Not only does it respond to the decision by the Supreme Court of Canada in terms of amending the Criminal Code, it also provides an excellent framework to facilitate the necessary changes to our healthcare system, which responds to this decision. Our government has listened to Canadians. Our government has listened to the experts. We have developed an approach that we believe reflects this input. It is now time to move forward with this legislation so that individuals, families, and health professionals have more options for end-of-life care, including medical assistance in dying. Thank you, Madam Speaker.
Questions and comments? Questions et commentaires. The honourable member for South Surrey, White Rock.
Well, thank you, Madam